makes therapy successful. I mean, or
Right.
yeah.
Yeah.
So right now, what do you see as the cutting edge for common factors, and what questions are still out there for this
Sure.
area of common factors research?
Yeah, there are a lot. One of the main ones is one of the presuppositions of common factors is that no one approach will fit everyone, and therefore what drives what you do should be the client rather than your sort of a priori choice of a model. And so, okay, I'm working with, Steve, here's what he seems to be resonating with, MRI or something. And so the trick is, if I'm doing that and then all of a sudden it starts to not work, well, what do I do? And so where we are now, like the cutting edge of common factors, is what is the smallest transportable unit of a therapy model? Each therapy model presumably would say have like dozens of little transportable units, bits.
That become hallmarks of that model.
Sure.
The genogram.
For Bowen.
Yeah. Differentiation from Bowen.
Right.
Principles of communication.
Sure, the miracle question from solution focus, that type of thing.
And you're calling it a transportable unit, right?
We're sticking in the Star Wars metaphor, I guess. Yeah, the smallest, where you can take it from there and plug it into something else, and it still makes sense from like a broad sort of principle-based framework, but like it's integrated essentially. Yeah. It's not purely one model.
Okay, so as an MFT educator, sometimes I struggle with therapists being eclectic.
Okay.
And eclectic has meant I use whatever comes into my mind, or whenever I get stuck, I become something else.
Right, seat of my pants kind of therapy.
Right, but you're saying, what if it were a specific model that had these elements that were the key elements of these other, the effective parts of these other models?
Exactly. So the principle-based framework, common factors framework would say, okay, we know that in the beginning of therapy, for example, if your couple is, let's say, high conflict, here are the things you're going to need to pay attention to. You're going to need to be able to make sure each of them feels validated to the extent that the other one's not invalidated. They're going to each need to feel heard, that type of thing. And there are 4 or 5 different models that really focus in on that. Here's one. So if you're starting with EFT, let's say, and they don't like it, you can switch to something that's a little more palatable, but is still doing the same thing. So it's client-driven. It's based on the assumption that therapy with each client will look different, but it will follow the same principles.
Okay. This may sound like a crazy question, but do you consider this clinical research? I put air quotes around clinical research.
Sure. Yes. Yeah, definitely.
Okay.
The research itself, I think, looks very process-based. So a lot of, say, like videotaping, like, okay, here's, we'll stick with early session, for example, here's what's going on in the early stage. We're coding to see whether or not we think it will make a difference if the therapist sort of validates each of them fairly equally, let's say.
So picking out a principle, a hypothesized common factor.
Sure.
And then testing to see.
Exactly.
Okay.
And then you follow them and see if that makes a difference, the presence or absence of it, let's say. See if it's correlated with outcome in any way. See if it's correlated with other measures that we know are related to outcome, like the Alliance.
So, and I would assume that at some level you're looking at multiple theoretical perspectives, and so you have a therapist who proposes to be or purports to be a Bowen Family Systems therapist, and one who purports to be a solution-focused. And so you really you're putting a lot of trust that these individuals are purists. Or does that matter in this research? You would think you would want as much control over that as possible, so then you could say, okay, we've got these 10 people to represent these 10 models.
Sure.
and what are the common factors? Am I getting a sense as to how it's done, or is that too complicated?
Well, no, you could do it that way. In fact, my dissertation was similar to that, where I interviewed developers of models, Sue Johnson, Dick Schwartz, Frank DiTilio, and then their students, people that practice the model purely, if there is such a thing.
If there's such a thing.
Yeah. And then looked for commonalities across them. So you can do it that way. You can also do a more naturalistic. I mean, most people, you have that whole balance of the more pure we make it, the less like real therapy it really is.
Right.
And so...
Well, that debate between what is effectiveness and what is efficacy of research.
Exactly. Yeah, exactly. So it really just depends on where you stand with that.
Okay. And what are the challenges that you face in this, or as you see what the cutting edge is? You talked a little bit about the cutting edge. What are the challenges in getting there, or maybe even a follow-up? Are you kind of a lone ranger in this research, or are you collaborating with other people?
Sure.
So challenges, and then you talk about collaborations.
Sure. The challenges at this point are getting it conceptually down. Right now, a lot of the movement, I guess you could say it, the rebellion, the insurrection, is at a conceptual level. Like, okay, we need to make sure we're asking the right question. We need to make sure the question makes sense conceptually, because it really is a new paradigm, I think. So the challenge is making sure we have that the paradigm is philosophically consistent and makes sense, and that's where we are now. So a lot of my work has been theoretical.
Pointing back to theory.
Right.
Yeah.
And conceptual. Most of my writing, my book I wrote recently with Doug and Jay, it's largely conceptual. It isn't really, here's a study we did.
And is it also practical? I haven't seen the book yet. I will go out and get it today.
Please.
Is it also practical? Is it like, here are the common
Right.
factors, and here's what you need to be doing?
Sure.
Here's what we believe are the common factors of effective therapy.
Mm-hmm. Yeah, it is.
Okay.
And here's what we know about how to do it, that type of thing. So the biggest challenge then, now is getting it conceptually sound before we move forward, and that takes a while.